Selamat pagi semuanya. Jumpa dengan kita dalam podcast Health Literasi atau Literasi Kesehatan dengan ASEAN Health Literacy Association Indonesia Office yang ada di Udinus. Nah, untuk podcast pertama kali ini kita akan membahas tentang apa sih literasi kesehatan itu dan Ahla itu sebenarnya apa. Nah, kita akan membahasnya. Nah, di sini telah hadir narasumber kita yaitu Prof. Peter Chang. Beliau adalah presiden dari Health Literasi. Jadi kita akan membahas tuntas tentang health literasi itu apa. Okay, good morning, Prof.
Good morning.
Peter Chang.
Yes.
How are you doing?
Good morning. Very well. Selamat pagi. Should I say
selamat
hi
pagi
to everyone in Indonesia, in Semarang?
Yeah, in Semarang, especially in Semarang.
Semarang, particularly.
Yeah. How many times that you visited Semarang already?
I visited at least 3 times, I believe. But every time are different. Every time I have very different experience. And I hope I will be able to visit Semarang as soon as possible.
Yeah, after the pandemic, and also we will have one of the seminar of the health literacy in Semarang, right?
Yes, definitely.
Yeah.
In 2021.
Yeah, in 2021. Yeah. Okay, so I think I will start asking about Ahla first. So it seems like you are the initiation of the association. So why you built this association that focus in the health literacy?
Well, it's about 10 years ago. I was amazed by one of the European 8-country studies, which was brought to us in Taipei by Professor Herman Brown. By the time European already almost finished the 8-country survey, and which is compared the health literacy activity and the capacity of 8 countries in the public, and which is amazing, right? You can compare people's general public's health literacy capacity and their performance in many countries in the same time with very standardized questionnaire. And I see this is very important. Secondly, there are very, very big difference between countries. In Austria, they are much lower than the Germany, which is a German-speaking country next door. What make the difference? And Bulgaria and Spanish was much lower than the others. So this is very striking to many European health officers that health literacy really were different. And if we do not know these are different, if everyone are very good in health literacy, well, maybe we will be very happy. But in the same time, we find many European countries are having very different health literacy. And I was very surprised that do we have a similar study in Asia? Have we compared with the health literacy capacity of Indonesian people and people in Taiwan and in Philippines, in China, in Vietnam? We do not have anything by the time. So in 2011, we started thinking about maybe scholar which is interested in health literacy, we should work together. And which was beginning of this Asian health literacy, I would say, movement in 2011. So in 2-3 years, we are very lucky to have many public health student, the teacher like you, in very far away. I didn't know Semarang at all by the time, but we were able to make the first international video conference with Annie in Taipei Medical University, and I was the instructor in TMU. And so through this international internet discussion, we learned there's a great need and expectation to have a cross-Asia health literacy movement, that people in every country, in every community would be able to know their health literacy capacity, and that we can improve them, we can help them upgrade their health literacy capacity. So this is very important. That was almost 10 years gone by. We were very lucky to have you in Indonesia in Summerland as a leader in your country to join this health literacy movement?
Yeah, so actually I remember that Annie told us about the health literacy, and she mentioned that Udinussul being the part of the health literacy. Actually, in that time, I'm still a student, so I don't even know what is health literacy. But uh, yeah, but I think it is something new that maybe I have to know about. So yeah, I decided to join the health literacy. And can you explain more details, like why we need to know first is the level of our health literacy?
Well, what is health literacy? Literacy is knowing, understanding, and expressing. So health literacy is really to know health, but not only knowing health, but also own the health. Health literacy is just like a person's right. You know, you have a freedom to know more about the health of your body or your mind, or even the health of your families. So health literacy is to know the health, to own the health, to improve the health. And this is our job. It's not the job of others. It's our job. We were born, we have the right to protect our health, protect the health of our families, our parents, our children. So we have to know it. If you do not know it, it's impossible to upgrade, right? You have to know it. So health literacy, by definition, you know, the newest definition is that we need to get access to health knowledge. Do you know where to upgrade your health knowledge? I would give example immediately. And know the message of this health information. What was that about? And to internalize, to appraisal, to really putting this health knowledge into our mind, and we understand, and also finally to practice, to practice. Let me use the COVID-19 as an example.
Okay.
All right, we know the virus could be transmitted easily by aerosol from one person to the other. So if I want to protect myself, how do I protect? Because we do not see the virus, right? It's impossible to see the virus. It's impossible to know who is having the virus in their body until they are really sick. So we have to know this virus first. We cannot see it. Without seeing it, but you know it is there because someone got sick, they got diagnosis. And now, second is that how to protect ourselves. The face mask is one example. How to protect you? You know, one of the best way to protect yourself and the community is to use face mask because it's very cheap. As I know, it's not very expensive, and it's very light, very easy to handle. So second, you have to know face masks can be very useful. But face masks, in the beginning, there are two sides of face mask. You see, this is whited. This is a little bit darker green. Which side should we use it? In the beginning, I do not know it. I ask that, oh, actually, this lighter side should be on my side. They are different. I saw the outside, inside are different. No, actually not. This side was, they coated with skin protection because this side will be on our face many hours. So this side, they use some easy, friendly, skin-friendly material. Outside, because raining, because wind, so they use a strong waterproof material, okay? But the mask is actually 3 layers. Inside, there's another layer, which is the most critical to filter, to protect the virus, all right? And I didn't know it. I didn't know. When I got the mask, I have to learn it, how to use it. Then the following is, I know the mask is useful, right? I have to read it, why it is useful, because the interlayer, this non-woven broom spatial textile, so-called PP, polypropylene material is very, very thin, and virus will be will be caught by there. So these 3 layers mask, I have to put it I have to put it when I was in a bus, in a crowd, or if I in a restaurant with many people. So health literacy about COVID-19 protection, we also need to know how to protect, use a face mask. Well, certainly this is not easy. Well, because some of the people, they don't like a mask. They like something else.
That's right.
So, right?
Yeah.
You know the mask is there, but they need to understand why it is important.
That's right.
Putting the mask is to protect yourself from someone you don't know. You don't know who is really got the virus. And also to protect you from infecting others. So this is very important that someone, so it's really protecting us, but also protecting others. Sometimes people say, well, I don't need to protect myself. I'm a very strong man, but sometimes we need to protect the other person. You see, the virus is really hurting those sick people, old people, and young people didn't really got many. It got easily struck by the virus. So, this is the way of health literacy. I see COVID-19 is really teaching us how to protect us from them, the virus, but also protect our family and the community. It's a part of the health literacy. And we can use this example in many other ways, in diabetes, in the influenza vaccination. We have many things to learn about health, and this is the capacity of health literacy.
So can we say that the health literacy is the key of the success for us for the prevention for many diseases?
Health literacy is part of the capacity. It's intellectual, but also physically of the individual. They know how to protect their health, and they know how to improve the capacity, their ability to protect their health, but also communicate. Someone knows it, but they don't tell, right? For example, in health literacy, in clinical service, we talk about, okay, you need to ask the doctors, you need to ask the hospital nurses important questions. If someone cannot ask a good question, do I need to take this medicine for every day or after every meal? Do I need to do this surgical operation? Can I do something else? How can I improve my nutrition? We need to know, to ask. So we encourage individuals to ask questions. If they do not ask questions, there will be a lot of problem, right? We tend to say, you ask at least 3 questions from your doctor you just visit. When are you going to recover? When are you going to avoid, to prevent recurrence of the same disease? This is all very important. And we need to learn from the doctor, the hospital, the nurses. On the other hand, it is job of the doctor, the nurses, the hospital to teach, to share the health literacy information to the patient, to the customer, to let them know, because the hospital is not to just sell the drugs or to ask them to do a lot of diagnosis, take the procedure or surgical operations. We need to teach them how to avoid to get sick, how to improve. So this is self-management capacity. We tend to say self-management capacity is also important. And we will learn from the hospitals, from healthcare providers, but also from families, and also from each individuals.
So we need both sides to be active, right? Not only the community is only receive like the information or anything, but the communities also have to be active to asking the question that maybe they need while visiting the doctor or something like that. Okay.
Yes.
So maybe we will talking a little more about the mask. So I remember that actually I found in the internet there is so many videos that teach us how we use mask, like the mask that you showed before, and some of the video is show us just like you have to tie the tight so it's make covered all the part of our face that they say it's safer, and also there is some information that said we can use both sides. Like if you are sick, you have to use the green one in the front, and then if you are healthy, you have to use the green one inside or something like that. So it's totally wrong. Is that?
Well, the mask is really, we use mask for many years, right? Almost 100 years ago, we used cross mask. But cross mask is more expensive and handmade, and textile industry doesn't like. And finally, they don't produce mask in many countries. I don't know about Indonesia, but in Taiwan, we forget to produce mask for the public. This is not used in the hospital, right? Hospital, they are more advanced mask. This is almost can filter 98% of the virus. I would say 98% of virus. You can put this to protect the dust. You know, there was air pollution, some big particle. You can prevent them. So mask is very commercial, right? It's a very available, but we don't produce that. But now, since in this COVID-19, we have to remember this. What is the best? You know, you can stay at home all the time, not going to school, but this is it's impossible for a normal student, right? Your student need to come to the classroom, and they have to sit in a classroom crowded, maybe. So in this, that how to keep the distance, we call social distance. If everyone stayed at home, so there is no infection, no transmission. But sometimes we have to go to the market, we have to go see some friend. You're really in close contact with individuals. So use face mask is one of a very, very easy way. I show you that the two-sided, and there was a stream, okay? And there was a little bit of steel over here to hold the nurse. So this is the lighter side I put. So in actually, oops, this is broken because I use it, but you can actually, you can, if you go to the hospital, they would ask you to put a face mask immediately. I have many others. So I happen to have another one. So I can put this because if I am the person with virus, I may expel some of the virus, but most of the particle will be trapped inside the mask already. I say that 98% until someone is really in close contact, right? So how many days you can wear the mask? If you wear many days, because there are humidity that our saliva expulsion to that. So 3 to 4 days, if you really wear 8 to 10 hours a day, it's got a little bit weight or humidity, and the virus, there was a charge, electric charge on the inside of the mask. The 3 layers, inside the middle layer, there was a little bit charge, and with humidity, it's going to disappear slowly. If you put this mask in a dry environment, you can keep it for months without any problem, because the charge will stay in the filter. But if with wet, if you put in the rain, under rain, the charge going down, the virus would not be able to trap easily. So in that case, the mask is less effective. So we have to know a little bit. We put it really fit our face, all right? But you cannot use it forever. So somebody said that if you do not have a mask very available, I don't know about in Semarang in Indonesia, but if it is not so available, for example, if you have only one a week, then you have to really use it carefully, right? You don't put it in the water, you don't put it in the rain. You try to avoid go to crowded, many people around there, because in that case, you need to certainly wear a mask. But if you always in the market with the crowd, you have to put a mask all the time, then the mask will become less effective, because the humidity on the mask is going to lower down the filtration capacity of the mask, and that would raise the risk of this weak protection. So I would say use the mask smartly. When you need to use it, use it. Otherwise, don't use it. if you are alone in your house, you do not have a close contact with anyone else. You are in the forest. Do not use the mask because the mask still have a half-life, shelf life, right? If you overuse it, the mask cannot work for you. And do not put in the water. Do not cook it. If you put in the boiling water, the mask will become useless. So put it dry all the time. Stay dry all the time, and this would protect you for a long time. But if not used for many hours already, try to replace. Try to get a new mask. But yeah, that is a little bit experience of knowledge about face mask.
Yeah. So for the mask in Semarang, for the first time the pandemic in coming to Indonesia, the mask price is very high, which is like more than to like how many dollars? It's like $20 for one box or something.
You mean
It's
US
very
dollar?
high. Yeah, it's
That's
very
very
expensive.
expensive.
So in that time, not so many people wearing masks, and then the government required us for wearing the mask. Like it's okay to wear the fabric mask, and yeah, it's something like that. So there's increasing people wearing masks, but because it is a long time already, like I think it's almost 10 months that we are in the
Yes.
pandemic, and I
Yes.
saw, yeah, I saw in the community there is people that not wearing mask is increasing.
You mean people without putting the mask increasing? Yes.
Increasing.
Well, this is a very important issue. I know that Indonesia and Taiwan, we share almost the same pandemic, right? And there's no effective medication. All the medication, new medication, even they have been in clinical trial, could be very expensive. And second, we do not have a effective vaccine yet. Many are on clinical trial. Maybe in 1 or 2 months, one or two will really come out. We don't know. We don't know yet. So if the virus really transmission, we're going to have a lot of casualty, a lot of patient, a lot of mortality in the hospital, in the community. So it's going to generate big loss, human life, the manpower, etc. So it's really not not the best way. Just wait. I think to put in a face mask is active prevention, right? Without jeopardize the life.
Yeah. Okay, so if we see in the community that still, I can say that maybe health literacy in Indonesia is still low. Uh, what should Ahla or ASEAN Health Literacy Association doing to increase the health literacy of the community?
Ahla is very proud to have a very active member from Indonesia, the Semarang, the University. And so I'm very happy being invited to be working instructor in your university, but through the video, the TVKU television is also very useful. And I think for Indonesia, early survey showing the health literacy has been not very high, and it depends on the rural and urban area and education. But you need to be very rich. People can be very well educated. You know, wealth cannot buy education, right? It's a knowledge and the intention. You can be very wise, intelligent. So I see the transmission of the information is very important. Ahla is very happy to have Ahla Indonesia office in your campus. And I think through this continued networking, we can improve the health literacy. So health literacy is not hard. It's not still. It's a dynamic. you can use many ways to teach or to help people upgrade their health literacy.
You can have a
Most
drink.
important, no, that's fine.
Yeah.
Most importantly, we have to use the opportunity, every opportunity, and put health literacy as the core of the health policy and health service. There are many people. I am alone in my studio, so I'm not worried about.
Yeah.
Okay, well, I have to make sure there's no one will be. Yeah, so using all the opportunity to share health literacy information and to empower and to repeatedly. There are always a lot of times people are talking about health will be the core of discussion. The reason female tends to be higher in health literacy to men is that women, when they talk about health much more than men. When men talk about each other, they don't talk about health, right? And this is not adequate. So we should put health in many as much perspective of our daily communication as possible, and not only professional like a physician, nurses, pharmacists, but all individuals. So I think that in public media, social media, we should have a more opportunity to talk about health, and that certainly good information about health is very important. In this pandemic, there are a lot of wrong information, misinformation. That also should be captured. So I think the profession in health literacy should be able to look at what is good health literacy information, what is not. So this is had to put a distinction for the public. But also we need to help the public to practice more about health literacy. Health literacy is not very difficult, no. It doesn't need to be in a university. It can be in high school, in kindergarten, between parents and the kids, between mother and the kids, between husband and the wife. Health literacy is everything. If you look at how many times we spend on thinking about health, we brush the hair, we wash hands, we do a lot of hygiene practice, which is about health. And sometimes we don't remember the reason we do it. So I think health literacy should be in every days, particularly nowadays we have a lot of mental illness problems in Taiwan, in our community. And I don't know about Indonesia, but mental illness is one hot top difficult issue for the modern world population. How to put in healthy mental literacy environment. There are many, for example, internet's really, there was a lot of electronic games already. Sometimes it hurt the youngsters very much. So we have to look at all the perspective of the health content in our daily life. Health literacy is not inside ivory tower. I tend to say that Asian Health Literacy Association is not just academy. Yes, we have to start it. People like you and me, we have to start it, but we have to disseminate. We have to provide this easy environment for everybody to understand, to practice. And the more they practice, and also they have to transmit this good information from one individual to the others. Its health literacy should be shared by many others. It's not the authority, it's not a patent, it's everybody's invention, it's through generation. Through our human civilization, health literacy has always been there, but we need more. We need more because when people getting more aged, we have a lot of high percentage of the aged population. We need having more health literacy in our society.
So health literacy is in our daily life. So we practice the health literacy in our daily life. Okay,
Yes.
yeah. Talking about the internet that you mentioned, and we also know that everybody can write information in the internet freely without any restriction the information that we share in the internet. So it's kind of make a new problem that we call it like the infodemic, because there is so many information and not all the information is the right one, and maybe it can be like that, make the community getting confused if they don't have a very good understanding in the basic of the health and how we manage it.
Well, it's good and bad that because we have this tool of social media, we have many, many ways of communication.
Mm-hmm.
Beside people face to face, beside group people talking, chatting with each other, they can talk about health. But now we can have
Mm-hmm.
electronic assistant
Mm-hmm.
communication. People can discuss over a long distance. So these are all the new tools. Means we communicate more on electronic, on smartphone, on PC. We are having less time communicate face to face. Can we stop it? I don't think we
Mm-hmm.
can stop it. We need to practice this electronic communication network mechanism more. And so people are bombarded with. Before, if you don't go to the particular area, you keep quiet, you keep silent.
Mm-hmm.
But now people communicate more so easily, and I think many people, including myself, are all addicted to these social media activities, and that is really dragging us big attention to something we think of between us. Before we write a diary, now less people write a diary. People express, reflect, respond more quickly than before, right? Before you
Mm-hmm.
write a letter, it takes a week to arrive someone receiving it. But now you write something immediately, and you can also write to share with many other people, like we are doing today. So this
Mm-hmm.
is a new phenomenon. We bombard with a lot of information. Um, this is really putting our mental brain capacity to extreme. Many people now have a neurotic mental difficulty because there are too many information they cannot digest easily. Sometimes you just have to stop communication. Sometimes you have to turn off the computer, right? This is really more and more. And we cannot ask, say, well, it's a few hours already, you have to stop. But I think sooner or later,
Mm-hmm.
we need to know how to protect ourselves, how to protect our families. That it's right
Mm-hmm.
to stop communication through this intense social media communication. Sometimes it's right. It's right, right? I just cannot respond now. It's not impolite. So I think we are
Mm-hmm.
faced with too massive bombarding, exponentially more information than we can absorb before. I don't know how our brain, I'm talking about all the human beings' brain, can tackle this. Now there's the AI and there IoT something ongoing, and maybe we should be reflect. I'm talking about not only health
Mm-hmm.
literacy, but also about
Mm-hmm.
health communication and healthy environment that we should sit back a little bit, do not taken away our mental capacity or by the machine. We need to sit back and to think what a human being, what we should really do. We shouldn't do everything. We should
Mm-hmm.
do just something healthy for us. So that is infodemic. Is the too much information.
Mm-hmm.
We cannot distinguish good and right easily. Many people, including myself, cannot distinguish what is good, what is bad. I got a lot of information. Sometimes it's beyond the judgment. I think we have to reflect to health literacy. We need to also reorganize what are the better health message, better health information to the public, which is important.
Mm-hmm.
There are many expertise they put a lot of information on the web, which rich people cannot understand easily, or they can only catch small piece of part of this whole picture. And if people getting a small part of whole picture, they get it wrong easily. For example, if you are covered with clothes and you touch the body of the elephant, you don't know really an elephant look like, right?
Yeah.
It could be the nose, could be the feet, could be the tail. So it's not easy to get the huge elephant, this information in front of us when we are covered with cover our eyes, Brian. So it's not easy. It's a new challenge. I hope we can work with you in Ahla to see how this information, particularly regard to health literacy area, can be more well managed.
Yeah. So actually in Ahla Indonesia, we also initiate to provide the right information in our website and also in our Instagram and in our YouTube and all in the channel that we have to provide the right information for the community, so they know that where shall I go when I want to have the right information about, especially about the health and the health literacy. Okay, and also I will also provide the website of the Ahla Asia in the description, and also Ahla Indonesia in the description, so everyone can access the website. Okay, I think we'll move for the next question. It is, I think we need to promote more about the Ahla. So, is there any specific requirement to join the association, or everybody that interested in health literacy can join the association?
Ahla was founded 10 years ago, and we are open for institutions and corporation to join us. So now we have more than 100 members in almost 20 countries in Asia. Indonesia also having a few very active. Thailand, your neighbors in Southeast Asia country, very active, very active. And I hope we can having more members to us. We set up the office in every country, but it's not limit to that mechanism. And there are actually more members from other country to Ahla. So therefore, we need the master. We need a teacher in every country, in every institution, in every city, or in every corner of the communities that they see health literacy important for the health of the public. They would like to exercise. They would like to promote this health literacy into every element of the daily life of the general public, and also in universities and in corporation. For example, some of the company, they are very important. They are very powerful, successful in their business. I hope we can have them as a member, because they can also disseminate the information to these individuals. You know, health literacy is not expensive. First, it's a knowing, but to choose good and bad, and to choose a good information to protect their health. And everyone can be a teacher for another one. Right? Your friend can be a teacher of yours, because no one said I'm the god of health literacy. No, we are all students. We also need to learn. Even I am in health literacy, I'm still learning every day that how to protect our health, and I'm thinking how to be very useful to many others, the friend. When people talk about health, when I hear people talk about health, and I'm thinking, are they doing good things? You know, are they getting the wrong information? Do they practice mistakenly? Now, this is and I would think about, are they example to provide them to be better health literacy instructor? So everyone can be health literacy in your universe, in your commit. So I see that to promoting health literacy in Asia Pacific, we need more leaders, a master. Everyone could be their master. Someone like you can be the health literacy master for in your student, in your classroom, in your university, in Semarang. I believe in Semarang, you are the best health literacy city in Indonesia. I believe that.
Thank you.
Because you pay attention to that, right? You pay attention to that health literacy can be useful in your city, in a huge city. And so we are encouraging more people, more community as a unit. We don't take individual member very much because we like to have an institution that can share this health literacy information. A membership for health literacy in Asia is very cheap. You know, we don't, it's not profitable organization. We are not taking money for that. And there are many corporations there support us. There are many individuals that support us. So we are not looking for a big budget, but the most important is that it's a knowledge. It's about health knowledge. To know health is everyone's. You can practice every day, you know, 1 or twice or 3 times a day without paying anything, as long as they know how to do it. Back to the mask, we still practice every day. And if someone cannot afford to buy a mask, we need to ask where can get a free mask. You know, for us, we donate quite a lot of masks to many other peoples. So there's no problem, right? It's not expensive. As long as the you know, the mask here in Taiwan is about 1 cent per piece of US dollar, just 1 cent. You know, it's very, and I can use this for 5 to 7 days.
Oh, even for the first time, the COVID-19, there is no increasing price for the mask.
Yeah, in the beginning, a little bit higher, but the government was control the price and encourage people to produce more. So it's you know, I can get this about 1 cent per US dollar. I get about a dozen of them already because I use it and it's a little bit. So I put it dry, put it in drawer. I put it dry, so I have 10 to 12. And I think if it is dry, I can still use it. I can still use it when necessary. You don't need to always use new one. And if that's very dirt, sometimes you gotta wet. There was a dirt, and you use many hours. You can tell in the beginning. This is the new one. I just take it from the drawer. It's very hard, you know. It's still, but the one the one I just broken down is very soft. Very soft means a lot of I use it many hours, many days. So I think this would not be very effective to use it to protect myself and others. So that I would not use it. Otherwise, you can keep it dry. Do not cook it. Do not put it in oven. No, do not do anything. The mask, if you stay dry, could be there for months without any problem. So this is a very simple way. So I don't think I need a lot of masks. If you have a 10, you can use for 1 year already. If you use them wisely, no problem.
So as long as the mask is clear and it's dry properly, it can be reused.
Yes, you can reuse it.
I see.
You can use it for yourself, right? You don't share this mask with someone else, right? We don't, because I will keep it for myself, right? You don't use it, you don't sell it. You better not to sell it, right? You don't give it to others. It's your personal protection. Protect yourself away from contaminating the others. Protect you from getting the virus from others.
Okay. And talking about the Ahla, actually in this year we're supposed to have the conference, right, in Taiwan.
In
Yeah.
Yes.
Yeah, because of
we did expect that it's going to happen, that Ahla Global Health Literacy Summit to happen in early October last year. And Health. I am currently the vice president of the association, IHRA. Is really happy to organize this conference, but since many people cannot travel, so we postpone until next October, early October. And the conference will be two ways, on site, person to person, or we have to use the video conference like us we are doing now. So there will be two ways. I hope by the time next year, I hope next year we would already overcome pandemic. Maybe you would wear a mask to Taipei. I don't know. I don't know when we're going to stop using this principle. In Taiwan, we have very low number of the COVID-19 confirmed cases. Many are coming from outside, but we still practice social distancing. Wear a mask. If you are going to the crowd, you wear a mask to protect yourself and the others. And when you come back, you wash your hand. That's the most important procedure. I think it's going to work in Taiwan. It's going to work in Indonesia. Now the summit next year will be two ways: the hybrid of the video and also on site. In the meantime, I hope now many study on how to deal with the COVID-19, the health literacy. I see there was a survey in Vietnam, very successful survey, put a lot of insight about health literacy can really help people. You know, Taiwan was very lucky to have pretty good health literacy that we protect ourselves. So I think the health literacy can really good for public health. Health literacy is everybody's business. Health literacy can be a good public health practice. It's like a co-sharing of the decision making, etc. So let's practice more health literacy. Even we don't meet together for this summit, but we need to practice. We need to communicate between us and to help others protect their health literacy. The better health literacy around the world, we're going to overcome the virus more successfully. Recently, we have a health literacy, vaccine literacy meeting with the IHRA. And I stress that we need to know what is this vaccine about. You know, many people say that, well, this vaccine would be a miracle, would cure everyone. But who are going to get the vaccine? How many people? Who will be the priority, right? It's not the tap water you open and you get a vaccine. No, it's not easy, right? And who is going to get it? Who should get it earlier? The healthcare profession should get it earlier. Those people with morbidities, disease, they should get it earlier. Those people, healthy young people, can get it later. Otherwise, we mismanage this vaccine availability. So there are medicine we have to learn about this vaccine now before we really get it. I know maybe it's another 6 months, maybe it's another 1 year before we really vaccinate it. I don't know. I don't know. This will be very big challenge for Indonesia and Taiwan that how we tackle the virus with vaccine.
Yeah, that's right. Okay. I think the next question is the important that maybe the university lecturer like me will be asked, like, how do we measure the health literacy? Do we have a specific instrument that we can access or something like that?
Okay. There are objective and subject way of measuring health literacy. Fortunately, in almost 10 years ago, European Health Literacy Survey, they have HLSQ, 47 questions, and they have been conducted in 8 countries and approved to be very good tools. And so we use that 47 questions translated to our language. I think in Indonesia, the same. That we also proved that the HLSQ will be very useful in Asia, except a few questions. So majority of the question very useful. It's a self-perception about your health. Do you know when to call a doctor? When do you know call ambulance about someone is falling down? Do you know how to get help to help the individual? When people got a diabetes, when people smoking, what about your behavior to respond to that? So there are many questions about this. And later we proved that there was a short questionnaire, 12 questions, is very useful. So if you have this health literacy things that we ask a student, how to detect the good and bad health literacy. We ask a few questions. And I think one of the good scientists in Taipei Medical University, he's from Vietnam, our Vice President, Dorman Dun, he developed a 6 questionnaire, very short questionnaire. I think 6 to 10 questions, you can distinguish health literacy of individual very successfully. I believe this short form can be used. In Indonesia, you can translate to integrate into your language, but not in English. I think it's better in your language. That, so let the student practice this short question verbally, right? You don't need to read the written. If you have a written questionnaire, it's really getting more barrier. How about 6 questions? If I ask 3, that you 6 questions that you respond, and I can tell you health literacy, that is very good. 6 questions about 5-6 minutes, right? And if someone feel comfortable about their health, they can tell you, oh, I got a diabetes, for example. When did I get a diabetes? How do I take medication every day? Besides medication, I also have a nutrition control. I have my diet plan, very good. These individuals are having very good health literacy. So for your student, and also my student and my colleague, I would encourage to use verbal, short question, a few questions. We can understand someone is really having good health literacy or not. This is direct management, but there are also many indirect measurement. If someone coming back from hospital, or if someone returning from seeing the doctor, and you ask them, what did you learn today about your visit? What did you learn from the physician you talk with? If they can explain to you, repeat the question of the conversation easily, means they are very good in health literacy. And but again, I mean, there's no 100%, you know, there's no king of health literacy. Everyone has something to learn. Someone know diabetes because they got the diabetes, or they have a family history, or they have family treated with diabetes. So they are good, but they may also catch up other information. So health literacy is the drive, the skill to ask question and to get a good answer. If they can, if you can understand something, go to Dr. Google, right? Dr. Google is most easy. In a few seconds, you probably got a good answer about the mask or COVID-19 or etc. Ebola. You can get it from Dr. Google. I hope Dr. Google will stay updated all the time. Keep away from wrong information. We certainly count on Dr. Google. I don't know in Indonesia, do you use that often? But for very specific pharmacy, medicine, I check with Dr. Google, and they are always a good institution. They explain to you how the side effect, how to use the medicine carefully. So this is good practice. If someone asks a question, I tend to say, well, check your Dr. Google first. And they tend to have a good information immediately. But encourage them, encourage the student to use that they would share with their colleague and student families that ask questions. Do not just take the message and inside do not and forget to practice. They need to practice every day. 1 or 2 health issue, then they will be very, very good in health literacy. So we have to put health literacy simple and easily. That's our job.
Yeah, and also there is no shortcut to increase the health literacy.
Oh, there's no, you cannot do a vaccine, say that a health
Yeah.
literacy vaccine and you know everything. No, there's no way like that. Getting knowledge and understand, you take time. Sometimes we encourage to be slow, simple and clear, right? Simple language, short questionnaire. People tend to explain the material very sophisticated. They tell you very complicated equation. They tell you a lot of jargon, new vocabulary. It's very difficult. If I go to a lawyer, he tell me a lot about something I couldn't understand. I ask them, can you write it down? Explain to me a little bit slower. Even I don't know a lot, but I learned something. If we put too much, too quick, too complicated, we confuse the people, and people will shy away. Then they are not to ask questions. They lose the opportunity to know it. So we need to have a good way of communicating the health issues between people, even between teacher and student.
Yeah, so in order to increasing the health literacy, we also have to change the way how we communicate, right? Because
Yes.
yeah, I see there is so many people. If there is they talking about information or something like that, there is some people will say, "Oh yeah, yeah, yeah," but actually they got nothing.
It's not easy because you know, human beings are very good diversity, right?
Yeah.
You will always track with someone, they have so little information, understanding about health, but that's okay. You know, that's what the professor or the health professional need to do. If everyone already very good in health literacy, you will see the health public will increase so much, will improve so much. We always have to face with some 10, 20%, which is very low in health literacy. In Taiwan, we have 20% very low health literacy group of people. And they were struck. They was kind of confused by the health system, and they misuse the health service. They forget and they neglect how to do it. These are the people we really need to help them. It's our job, right?
Yeah.
If you are student very good, you don't need to teach them. They can learn by themselves. But they are always 20, I would say 20 to 30%, 1/3 of individual in a community. They are very, very low in health literacy. Unfortunately, I sometimes feel so sorry about. It's not their own fault. It's the family, it's the hospital, it's the doctor. They treat them. I have a lot of very sad story. I can tell you some of them, but I have a few very bad example that people suffer from low health literacy, and they have been shopping between clinic and hospital many times. And I feel sorry none of the doctor or the hospital will stop them going to the crib of the danger. You know, we cannot say, well, they just do not behave themselves. No, it's a learning. We all learn from each other. We learn from good practice. So I think that we all have to be the safeguard of the health literacy. Some really are not having good health literacy. I would say 1/3 of the population in our community. We need to think about how to protect them, how to help them out of this danger. That's our job.
Yeah, so that's why inside the health literacy is how we spread the information, how we educate around us, right?
Yes, yes. We have to be the core, the driving force of our colleague and our friend.
Yeah, that's right. Okay, so is if I'm not wrong, is there one key that I got from our conversation here that I can say that health literacy is never ending uh, study. Yeah, that's right.
Oh, well, thank you for saying that. Health literacy is not a degree. It's not to say you are undergraduate high school. No, health literacy is a health. When we were born, when we were born, we were giving to our life, and we have to protect this health, right? And our health coming from mother's health and father's health.
Yeah.
And that health was transmitted to us, and we have a responsibility to keep on this health practice, improve our health until we become father. I hope we'll be grandfathers one day, and we have to be grandfather with good health literacy, because grandchildren will ask me, how do you protect your health? So we have to grow our health literacy all the time. Our life is short. In 100 years, we come to this world, we learn, but we also learn from others, from parents, mothers, and we have to transmit this information ongoing to the next generation or the generation to come. So health literacy is not a degree, it's a learning process. It's keeping us healthy. Health literacy is everybody's skill and also responsibility. We have to share, we have to teach, we have to learn, right? It's also our right to learn how to be healthy. And it's between our civil society. I think health literacy is part of the literacy. If human being, I'm talking about more significant philosophic way. If human beings are going to stay on Earth for even longer, right, millions years, we need to grow our health literacy. We were successful to live civilization, this world, because we keep very good health literacy in the past. Now the world become more complicated. We have a lot of problems. We have HIV. We have many problems. We have COVID-19 to our challenge. We have to continue growing our health literacy. This COVID-19 killed a lot of people. In fact, billions of people. Means we are not ready to have enough health literacy to tackle it. Otherwise, we should be able to overcome it quickly. But no, we're still learning. So I think COVID-19 is giving us a good lesson that we need to catch up our health literacy, and we have to drive our health information technology ahead and keep our population in health condition. So I would say health literacy is lifelong learning, just like we keep our healthy life lifelong, from cradle to the grave.
Yeah, and also keep sharing and keep learning.
Yes, keep on learning, keep on working.
Yeah, keep on working. Yeah, okay. Thank you, Prof. Chang. I think that's all the question I have. Is there anything that you want to share?
Well, it's important for me to learn from Ahla, Indonesia, from TVKU, the University Television. I hope our discussion will be useful for many of the audience. I'm sorry I cannot say Indonesia your language. I hope I will learn next time a little more. I'm hoping to visit your country to see Indonesia again. I hope next year. Let's keep 2021. You come to the Global Health Literacy Summit. You're always very good in that. I hope I can return a visit to Semarang again. I hope Allah will be with you all the time. We are very happy. Again, we are very happy to have Indonesia partner. You always the most stronger support for Ahla. And I think we would helping you to pass the torch throughout Indonesia. You've been very respected, and your participation. I hope today's program will be very useful, and you can continue this dialogue with Ahla. Maybe you can dialogue with other Ahla countries, like your neighbor countries. They are also very good in this. I hope TVKU will be very successful. Thank you for organizing this program today.
Okay, thank you. Yeah, and we also can be more active if our university is not support us, but we are glad that Udinus always support us for going to the conference that annually conference that Ahla Asia has, and yeah, we are very glad that our university is support us 100% to doing the good thing with Ahla Asia. Yeah. Maybe I have some little update that what we have doing in Indonesia by Ahla
Okay.
Asia Indonesia office. So yesterday we installed water filtration in our community. I can see you the picture. If you see this the like
I'm showing the.
oh.
Okay, I like to share this with the friend. Yeah.
Mhm.
Okay, beautiful, beautiful.
Yeah, so we install filtration because in the community they have like a small farming in the city, but they don't have good water for the watering the crop. So we, with Ahla, install the the air water filtration, and they use it to watering the crop. And then in that activities, we also try to educate them to promote the health literacy. So we can have at least like a pilot project in the one community that can develop a good health literacy in there. And we are still in process. And I hope that when you coming in Indonesia, we can show you our little project.
I will be very happy part of your project. I was always been surprised, really excited because I remember 10 years ago, we are having the first time in TMU in Taipei with your university, and Annie was with me, and you were, and Najala was there, and you start to do the health literacy survey. And I asked Najala, can you send a few pictures when you are doing this survey in the rice paddy field? I was very, very amazed that you are broaden our landscape. You know, we were in Taiwan, we was a small island, but you have a huge land mile, miles of rice field in your walking. I appreciate your sharing. Really, we have learned a lot from you, and I hope your farmers' health literacy project is going to succeed wonderfully.
Yeah, thank you. So yeah, and maybe if there are any another session like this, I will share for another topic that we can share for each other in our YouTube.
Yeah, that would be with great pleasure. And I can also invite our Secretary General,
Yeah.
Julian Dean, and also Vice President Domandun. Professor Domandun is very, very active promoting health literacy. We can, next time, if you organize it, I would invite him to join me together. I think he also has a lot to share with you.
Oh yeah.
You are our really. I'm very, very happy to know Ahla still doing things which we like to do.
Yeah, we will keep doing it.
Okay, good.
Yeah.
Until then, I see you next time, and best good luck for Indonesia to overcome the virus.
Yeah.
And meanwhile, we learn from you.
Yeah.
Thank you.
Okay. Thank you.
Thank you so much.
Yeah.
Thank
Goodbye.
you. Okay, bye bye. And you can send me the click when it's done.
Yeah, when
Thank
it's
you.
done, I will send you.
Thank you. Thank you so much.
Yeah.